everybody. Welcome back to the Tooth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I've been practicing in the dental field for the last 20 years. If this is your first time joining the podcast, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the information, the tools, and the resources to help improve their dental healthcare experience. So, there is a way that you can receive free and discounted dental healthcare, and I'm going to tell you all about that now. So, for some of you guys, you may or may not have dental insurance. And if you do not have dental insurance, you can call your dental office or an office that you've never been to that you're interested in going to and ask them if they have their own in house dental discount plan. So, a lot of offices have this. Now, I work in New Jersey and I'm also licensed in Pennsylvania. And all the offices that I've ever worked at or temped at, either in New Jersey or Pennsylvania, all have their own in house dental plan. And basically, this plan is a discount plan where they offer patients who do not have insurance. So whether you're in between insurance and you're looking to get insurance, or if you're just without insurance and you're not sure when you'll be able to pick it up, they offer discount plans. So for my office, I'll use my office as an example. They have a discount plan where you save 30%. So you have a 30% discount on all of your restorative work. So that's your fillings, your crowns, your dentures or partial dentures. If you want implants or if you need root canal. So any of the restorative treatment, that will be discounted at 30%. Now, if you are just trying to have your basic routine dental care done, so your cleanings, your dental exams, your x-rays, checkups, my office offers the discount plan, not only with the 30% discount on restorative work, but also on those routine procedures. So for instance, for the year, you pay $150, and with that $150, you get 2 cleanings per year. So every 6 months, you get all the x-rays that you would need for those checkups and cleanings. You get your checkups, your dental exams, as well as any emergency appointments and x-rays associated with those emergency appointments. So if you're having a problem with a tooth and you need to come in and have the dentist take a look, that visit is covered, as well as the x-rays needed to figure out what's going on. So $150 for the year is so doable, especially if you're not going to the dentist. So if you're saying, you know what, I'm not going to go because I don't have insurance, at least this gives an option. So just check. If you've never been to a dental office, you can either look them up online. Their website should have all of this information about these discount plans, or you can just make a phone call and inquire about it from the front desk staff. Ask if they have any dental discount plans in place for people who do not have insurance or are in between insurance. The other thing I want to talk to you guys about is if you need any extensive treatment. So say you need crowns or bridges, or you're interested in having implants or implant supported dentures, or wisdom tooth extractions, bone grafting, any kind of procedure that your insurance may or may not cover. So whether you have insurance or not. So if you have insurance and they cover very little to major treatment, or if you don't have insurance and you're interested in having these things done. So what you can do is you can call to any dental school. So for instance, if you call Penn or Temple, they both have dental schools there, and you can have dental work done at these clinics for either free or at a very low discount cost. So you can go on their website, either the Penn Dental School or the Temple Dental School, and you can even call the clinic and talk to the receptionist. So you can call and talk to the receptionist, and you should be able to get a list of how much certain procedures cost. And like I said, they are either free or on a sliding scale. So There are some negatives to this. So the positive is that you'll be paying either nothing or next to nothing, which is amazing for some of the things, especially implants and dentures. They can be very expensive. Implants alone, one by itself, can be, between $5,000 and $6,000 in the state of New Jersey. So that's really good. But the negative is, okay, so they are students, um, but the upside to that is that they are students. They're in school and the job has to be done correctly. And then they're also, supervised by dentists and doctors and their instructors who they have to make sure it's right. So you're not going, it's probably going to be the best dental care that you ever get because somebody is checking their work and making sure it's done the best it should be. That's something you're not going to get out on the street in a regular dental office. So that's a plus and a minus. So if you're iffy about, seeing a student or having a student work on you, then that might not be something for you. But the other negative is that usually when you have work done at these dental institutions, the schools, you are going to devote a ton of time to doing so. So I'll give you an example. When I was in dental school, just for dental cleanings, just for cleaning, they blocked out a 3-hour block. And when I think about it now, it sounds ludicrous, but it is a learning situation. So when I go back and think about that, I'm like, okay, yeah, we probably didn't need 3 hours, but that's for the instructors to come to check to make sure you get all of your proficiencies done. So the negative to you going to a dental school is the fact that you are going to be spending a considerable amount of time there. So the appointments are very long, as well as you may have to come back for multiple visits. So this is actually a good thing for a lot of senior citizens who have a hard time making ends meet already, and they need help with subsidizing their dental care, but also they have time. So they're able to, because they're retired mostly, or they might have more wiggle room in their schedule, they're able to sit for those appointments or make time for those. But really good for anybody who really is like, you know what, I can sacrifice the time in order to, have this procedure that would have cost me $1,000 or whatever at a super discounted rate or even for free. So I just wanted to come on quickly and talk to you guys about that because I don't think it's something that's talked about often. But yeah, whatever dental school you're interested in, you can call that dental school, call their clinic, see what time the clinic hours are, see if you can either go on their website or have a list of their fees fax over to you if there are any fees. A lot of these soon-to-be dentists and hygienists, they need to have these things done. So a lot of times they will pay. When I was in dental school, I paid a good amount of people because I needed these people so that I could pass. So you might even find that you get some money in your pocket for somebody who really needs to have you as a patient. But that was it. If you guys have any questions about this, any more information, please email us at toothbetoldpodcast@gmail.com or hit us up in the DM or comments of our page, Tooth Be Told Podcast, on Instagram. You guys take care. Enjoy the rest of your day, and we'll see you next time. Bye.